I'm Dr. Rohr, and let's get down to this lesson. The videos that I've put should give you quite a bit of information on both the conduction zone as well as the respiratory zone. Most of the other objectives will also be covered. There's a third video that has to do with the autonomic nervous system and how its effects are manifested in the lungs. It's a little bit more than you need, but it's a short video and it should be very helpful. So let's get to it. First, we're going to look at the objectives. As you can see here, describe the functions of the respiratory system, including the pleura, distinguished between the conduction and the respiratory. So what is the function of the respiratory system? Well, it's to take in air, to get oxygen, and to expel air, release carbon dioxide. Those are the main functions. However, there's a lot of secondary functions that the respiratory system contributes to. Specifically, that's gas exchange, oxygen, carbon dioxide. Also communication, so our ability to speak, to create sound. The respiratory system is vital to allow sense to get to our olfaction. We also use the speed of breathing and the ability to remove CO2 to cause an acid balance base, and we can change our speed of breathing and depth of breathing to account for that. The lungs are a place where angiotensin II is created, which is helpful for blood pressure regulation. Additionally, some things that we often don't think about. The thoracic pressure in the chest cavity aids with blood and lymph flow. Additionally, the lungs are a place where we filter out small blood clots that can take place anywhere in the body, and then they are collected in the lungs where they don't cause issues. And then lastly, by fixing the thoracic volume, we can aid with expulsion of abdominal contents. When we talk about the pleura of the lung, there's two. There's the visceral pleura, which follows right along the lung, and then there's the parietal pleura, which lines the thoracic cavity. These two pleura have a potential space in between them, so there is no actual space in normal day-to-day life. It's a negative pressure, so as we expand the lungs, the two pleura are stuck together, and so as the rib cage enlarges, the lungs will enlarge, creating a negative pressure on the inside. Additionally, there's some lubrication between the two pleura. This allows for our lungs to effortlessly slide as the chest cavity enlarges. Okay, the next thing we're going to talk about is Objective 2, understand the three functions of the conducting zone. So the conducting zone we can see is where the air is conducted all the way down to the lungs. There is no gas exchange in this region. The videos go over this. Specifically, what are the three functions? To warm the air, to humidify the air, and to clean the air. And that makes it better for the lungs when it gets down there. So when we look here, we have the nose, and in the back, this is the area we call the nasal pharynx. Anywhere that's behind the oral pharynx is right here, and then the hypopharynx down here. This is what we call the larynx. This is where the voice box sits. We don't want any food to go down there, so the epiglottis sits on top, and as you swallow, this will raise up, the epiglottis will be pressed down, and then causes the food to go back into the esophagus. The voice box is extremely important for phonation. It creates a tone. The tone can be elevated or decreased due to the tension that takes place there. That happens with the arytenoids abducting or adducting. There's a few other muscles that help with fine tuning of the pitch. The actual sound and the ability to speak and have resonance is because of the resonance chambers of the sinuses, as well as our ability for our lips and our tongue to articulate and create what we actually understand as speech. The voice box itself just creates a sound. Describe the three changes that occur from the trachea to the terminal bronchioles and the importance of the trachealis muscle. So as we start in the trachea, we'll notice that there are tracheal rings made out of cartilage which are supporting it. This is also much thicker. No gas exchange takes place here. As we move farther out, we transition from tracheal rings to tracheal plates that sort of overlap. And finally, as we get into the bronchioles out further, there is no actual cartilage surrounding these areas. Lastly, we talk about the trachealis muscle. We can see this. It's on the posterior aspect of the trachea, and what it allows for is swallowing to take place and for this to be able to have some motion to prevent things from getting stuck in our throat as we swallow because it's being caught on the firm posterior tracheal wall. The remaining objectives are well described in the following videos. Additionally, the anatomy and structures can be reviewed in the book. If you have any questions, bring them to class.